The topic for today is allergies, and with us here, Dr. Lionel Herrera with Tri-Valley Pediatrics, board-certified pediatrician. So, tell me about allergies.
Allergies are those annoying symptoms you get during a beautiful spring weekend when all of a sudden you're sniffling or sneezing, and as time goes on you might start having itchy red and even swollen eyes, or you might even have some difficulty breathing because you're having asthma symptoms from allergies. They can vary quite a bit.
How are they usually treated?
Traditionally, allergy treatments have focused on symptom relief. So medications like antihistamines that you take on a daily basis, which do decrease your symptoms but don't actually treat the cause and often result in side effects like drowsiness that are not wanted.
What are allergy drops?
Allergy drops are a new way of treating allergies. It's a safe and effective way. It basically takes the pollen that you're allergic to and puts it in a micro concentration in liquid form that you take on a daily basis. And by taking it on a daily basis, you eventually lose your reaction to that pollen and your symptoms go away as the treatment goes on as well.
And does it work?
It's been found in many studies, many European studies, to be a safe and effective treatment for allergies.
Is it safe?
The World Health Organization, which is an independent body of physicians, has approved the use of this medication, and as early as 1998 actually wrote a consensus statement that stated that it was a cost-effective way and safe way of treating allergies.
How does the process work?
We essentially start off with a simple blood test. After we learn your results, we send those results to a company that specializes in making the allergy drops. They make it into a liquid form. They mix a little bit of sugar into the preparation and put it into a bottle. They send the bottle to us, and then we bring you in. We show you how to use the medication. We make sure that we give you the first drop in the office to make sure there isn't any significant reactions. And then you'll go home with the medication and you'll take it on a daily basis. Every 3 months, we gradually increase the concentration of the pollen in the medication so that you are more likely to lose your reaction to that allergen that you have. The process does take about 3 years, but it's a very cost-effective way of treating allergens.
What is the difference between allergy shots and allergy drops?
Essentially, it's based on the same principle. We're taking the pollen that you're allergic to and we're making it to a liquid form. With the allergy shots, of course, we're injecting it underneath the skin, or the allergy drops, you're basically putting a few drops underneath the tongue. So that's one distinction. Allergy shots require weekly visits, but they're weekly visits to the doctor, whereas allergy drops, although they're used on a daily basis, after the initial treatment to make sure everything's okay, we have you do it at home. And so the vast majority of your treatments are going to be done at home with the allergy drops, making it much more convenient for our patients. And of course, because it's less traumatic for the patients, we feel that patients are more likely to comply with the therapy and finish the therapy, which is the most important part of the treatment. It won't work if it's not used.
And what is your advice for parents that battle with, their children battle with allergies every day?
The key advice is prevention, which is such an important part of using the allergy drops, because one of the things and one of the advantages of using allergy drops is that we can start at a very early age, as early as 4, and prevent them from having more and more severe symptoms. There's a condition called the allergy march where patients start off with very mild symptoms, maybe just rashes from allergies, that leads to hay fever that can then lead to asthma. But we can stop that cycle and stop that march by using these prevention strategies and stop the allergies from getting more severe at an earlier age. When it comes to allergy shots, 4-year-olds, try giving 4-year-olds allergy shots. It's almost impossible. Many of our allergists will delay giving those therapies until they're much older, preferring instead to use medications that have the potential for significant effects and significant side effects instead. So using allergy drops can be a natural and safe way at preventing allergies.
Very interesting new technology. Thank you, Dr. Lionel, on our topic on allergies today.
Thank you.